Okay, we're on part 5, same book, Solving the Multiple Sclerosis Mystery by Hal Huggins. There's a lot of stuff to know here, but it all fits together. And once you got it, then you confidently have it locked in. Then it's a big thing you know the rest of your life on how to prevent disease. Ionic mercury can gain entry into motor nerve terminals going through calcium channels. It's Hg2+, calcium's 2+. Ionic mercury, that's Hg2+, it binds very tightly to self-hydro groups. That's a key point. And bacterial toxins and mercury can travel into the brain via nerves or veins, and they can cause brain damage. Okay, again, all the page numbers from the book are in here. Given that lesion is somewhat variable, the lesion location is a little bit variable in the brain, most often periventricular, supratentorial. It can be subcortical, it can be posterior fossa, it can be spinal cord. There might be multifactorial causation. In over 1,000 cases of MS that Huggins treated, only 2 of the patients did not have amalgams. And they could have obtained mercury from bacterial toxins or just brain injury from bacterial toxins. Okay, mercury can be a hapten, meaning it can bind to a protein and distort its shape. Like it can bind to a cell, distort the cell's shape, and then the cell will be seen by the immune system as non-self and destroyed by the immune system. Most of the high blood pressure I have seen has been the result of having a root canal procedure in the body. Usually the blood pressure will drop substantially within 4 days of properly removing a root canal. Okay, now that statement I think is a little bit funny, and I think it's a little bit ridiculous. And the reason, why would he say something like that? Because those are the people he deals with all the time. He's always dealing with post-root canal people. That's the main thing in his practice. So I think that's a biased sample set on that one. Okay, almost everybody I see suffers from chronic fatigue. Now that's interesting because mercury lowers the amount of oxygenated hemoglobin in the blood because it'll bind to the sulfur groups on hemoglobin, the oxygen-carrying protein in the red blood cells, and distort its shape so it doesn't carry oxygen effectively. So it's going to drop the amount of oxygen delivery to tissues that can make you tired. It's also a mitochondrial inhibitor, so the lack of ATP production in your cells can make you tired. So they often have chronic fatigue. He says, watch out for vitamin B12. He says, do not give IV vitamin B12 when you have a mercury toxicity problem. He says, don't take vitamin B12 soon after a removal of amalgams, because it can methylate the mercury and make it a little more toxic. This guy, Boyd Haley, PhD biochemist, I made a video about him, and he's got videos at IAOMT. So does Hal Huggins. If you go to IAOMT YouTube channel, you can see their videos. He identified mercury from fillings as the main culprit in what he felt was Alzheimer's. Haley was working with Huggins on those gel electrophoresis samples where they showed multiple abnormal proteins in the cerebrospinal fluid of MS patients. And this went away when the amalgams were removed, which is good presumptive evidence. Hal Huggins says, we believe these proteins were from fragments of brain tissue destroyed by mercury and released into the cerebrospinal fluid. And something similar occurred with Alzheimer's, Parkinson's, Lou Gehrig's disease, which is ALS, amyotrophic lateral sclerosis, and seizures. After this discovery was made, the dental establishment revoked the dental license of Hal Huggins. Thimerosal, which is commonly used in a preservative for contact lens solutions and other things, could cause multiple sclerosis. Robert Schuller is a preacher. He said, the only false hope is no hope. And like Hal Huggins said, he said, I used to think people in wheelchairs were wasting their time coming to see me. Then I saw some of them get up and walk, and I realized I was the one who could be described as ye of little faith. Now I expect the wheelchair-bound patient to get up and take a few steps within 1 week. The mystery of multiple sclerosis is solved. Okay. So it's pretty amazing stuff here, huh? Okay, a little more here. Urinary symptoms are common with mercury. And he says, I think they often feel they have to go, but they don't void much. And it might be because the toxicity of the mercury is irritating the bladder lining. And he says, actually, if the people drink a little more water, they'll often not have to void as much. And he thinks it's because there's less toxin irritation of the bladder lining. And so that could be relevant to somebody who's trying to sleep better. Mercury can cause more cramps in the calves. I used to have cramps in my calves, but that was mostly when I would run more stairs. Because I run up tons and tons of flights of stairs during the daytime. And I also found that I can run up just as many stairs, but if I eat more veggies, I don't get those cramps anymore. So I haven't had those cramps for many months, and it's because I started, eating healthier. I mean, I was always eating healthy, but I got even more healthy. Healthy on top of healthy. I'm always trying to improve things. Let's see. Perhaps this is why, they don't necessarily go more often when they drink more water. Yeah, because the bladder stays full. So that could be relevant to a guy who's trying to sleep better with a big prostate. That drinking more water in the context of mercury toxicity might enable you to sleep more. So you can try it if you want. Women should be careful about vaginal lubricants and contraceptive gels because they often contain high levels of mercury, according to Hal Huggins. After 1984, when the research made it overtly obvious that mercury in amalgams was toxic, the ADA continued to say it was not. They also refused to debate the IAOMT guys because they know they'll lose. And mercury amalgam companies increased their liability by a factor of 1,000%. Yeah, they know it's a problem. So Huggins says, why do people lie? And he says one reason they lie is for self-preservation. If half of the MS, ALS, Alzheimer's, Parkinson's, birth defects, chronic fatigue, and unexplained depression patients was due to dentistry, what would be the amount of liability? If they apologize, that'll just incur liability. And with so many American lawyers looking for cases, why would they want to risk that? And like I said, others like Dr. Vimy, founder of IAMT, says they just want amalgams to slowly go away so they're not liable for the side effects. If a dental school doesn't get certification by the establishment, then the state removes funding and the school has to close. So the establishment really controls things, and it can revoke the dentist's license. Chronic fatigue happens because mercury distorts the hemoglobin and RBC binding to its sulfur groups. We talked about that. It also inhibits mitochondria. Many MS patients had braces when they were younger, and this might have killed a lot of lymphocytes. It can increase the risk of cancer. Mercury sometimes gets into the retina of the eye, and it might be associated, like we said, with optic neuritis, the characteristic, transient blindness associated with MS. High levels of urine mercury mean the body is getting rid of it, so that actually can be a good sign. Pickling salt has just sodium chloride and nothing else, so that can be useful to know because a lot of salts have a lot of other contaminants in them. Women with amalgams and root canals tend to have lumps and bumps in their breast and more fibrocystic disease. Yeah, lots and lots of women, and not just from Huggins, from Gamal and others, they said when they had their amalgams and root canals taken out, quite often the breast lumps will go away. Root canals are associated with lowered sperm counts and possible infertility in men. Male sperm counts are going down. This might be one of the reasons they got more of the modern amalgams with the copper in them that accelerates mercury vaporizing out of the amalgams. Mercury can cross the placenta, and it's associated with birth defects like cleft palate. Okay, so that's it for this number 5 on MS Mystery.